One of the things I think we really pride ourselves on in our division, in our section of minimally invasive surgery, is that we really pay attention to the individual patient. Minimally invasive surgery is a moniker that we use for doing really big operations through really small incisions.
As our knowledge of gynecology has grown over the years and the surgical capabilities and techniques have advanced, it turns out that residency is just not enough time to become a master of all of that material and all of those techniques.
The fellowship program really started decades ago, and this was an effort to try to provide a venue for people to hone their skills on surgical gynecology, because it was something that was sort of lacking.
This particular fellowship, it is an awesome place to work and train. Vanderbilt in particular has a depth and breadth that's unique. So we have that breadth from hysteroscopy to straight stick laparoscopy to robotics.
Fellows who trained in our program are going to have an excellent broad-based surgical experience.
It's a very clinically busy fellowship. We do have a big focus on research, a lot of resources for that. So that's been a big thing that I've tried to focus on while I'm here.
It means you're a player in the field. Like when you get to watch it and it's evolving right in front of you, it means you're also playing a part in that, and you get to put your stamp on it.
We have a program of graduated autonomy. So they start on a combined weekly schedule that includes time in the OR, time in the clinics, and time for research. Generally, on their first few days in the OR with us, an attending will do, for example, one side of a hysterectomy with the fellow and then one side with the resident who may be with us on the case. But as they progress through fellowship and start doing more cases, they really transition in their role until they're leading the resident through the case and the attending can stand between the legs and just sort of observe or jump in only when needed. And they really take over that teaching and leadership role in the OR.
So we have a very, very high, fast learning curve. We get people to an area of competence pretty quickly. We have certain program goals that we want our fellows to be able to achieve. Some of those are technical goals, such as the ability to perform certain procedures. Some of those are cognitive goals, the ability to recognize and understand certain disease processes. And some of those are sort of more critical goals in terms of diagnosis and patient management.
I think we pride ourselves on being a program that prepares fellows to truly manage the full breadth and complexity of benign pathology.
We have an institution that loves innovation and that wants to support that. We're a really approachable division. We're a really collegial division. We like each other. We spend time together outside of work and enjoy that.
We really want people who play well with each other in the sandbox. So we take good care of each other, we are nice to each other, we cover for each other, we make sure that people have a good life outside of the fellowship, and those are the things that are very important to us.
You're very integrated into the department, and there's often times where you're treated less like a fellow and more like a colleague, which is great in terms of asking for opinions about things.
When our fellows finish their program here, my hope for them is that they'll have a sense of the privilege it is to do this work and to then carry that on in training future generations of GYN surgeons.
By the time they leave the program, they are confident and comfortable in their skills. They're able to serve patients in their community and also serve as consultants, both for their patients and their medical colleagues.
Basically what I do is I try to help people understand their pathway to advancement in academic medicine and what makes sense for their career and how they get there.
The fellowship is not the end of learning. It's the beginning of the intense learning. I mean, the sky's the limit.
So when we're trying to recruit people here, it's really easy because Nashville is a great place to live and the reputation of the school just speaks for itself.